What do you think, Molly? Like,
Yeah, I think 2 minutes in, we can kick things off.
okay.
Thank you, Dr. Khan.
No problem. Hi, everybody. My name is Zia Khan. I'm a cardiologist at Queens, for the Queens Health System, the chief of cardiology there at the University of Hawaii. Also, the current board president for the Hawaii division of the American Heart Association. So thanks for joining us today. We have a very interesting topic. First, I want to thank our sponsor, First Insurance Company of Hawaii. I think our topic today is super important. Workforce well-being workforce well-being webinar. And man, this topic is near and dear to my heart and probably to all of you because we all work really hard, right? And so how do we work healthier? I think it's an important goal. And how do we build resilience? So do you want to slide forward? And so the key thing is, I'm sure as you know, work affects both our physical and mental well-being in many ways, good and bad. And mental health of folks, our emotional, psychological, and social well-being affects how we think, how we feel, how we act. It also helps determine how we handle stress, how we relate to others, how we make choices at work. And so how often how you take care of yourself, as you probably know, affects how you interact at work and at home. And so caring for yourself is really important. It's not only about your own personal well-being, but how you interact with your family, how you interact with your colleagues, and based on that, there's significant outcomes that are based on how you act. And so that's really important to remember. It's not just about doing it for yourself, but it's about doing it for the people around you and taking care of yourself and the people around you. Next slide. So some recent surveys data suggests that about 76% of U.S. workers reported at least one symptom of mental health condition in the 2021 survey. 84% of respondents said their workplace conditions had contributed to at least one mental health challenge. I know I do a mood app like every morning, and I know that when my mood is low, it's like I see three recurrent themes: work, exercise, and probably I'm not doing something on health, but it's work and exercise, work and exercise. I don't get enough exercise because I'm working too hard. And so I think that's an important stat that resonated with me. 81% of workers report that they will be looking for a workplace that supports mental health in the future. So as employers also, it's really important that we recognize this. Next slide. So here's a quote from our Surgeon General. So when mental health of workers suffers, so do workplace productivity, creativity, and retention. I read a stat that if you work consistently over 60 hours, productivity actually goes down, which is really interesting. Also sort of like non-productive work again, such as just like sort of passive aggressive stuff. And so I've been kind of monitoring my own work and making sure I try to hit that out, just like leave work at work so that you're fresh and your mind is ready the next day and you focus on productivity. And so really that mental health piece, the harder you work, it's not necessarily the more productive you are. So it's important to take care of your mental health. And so also it's my honor to introduce you all to our panelists today who will talk about what they've done in sort of the mental health space and how important it is for the workplace and how just how they support their employees. So today we have three panelists. The first is Dr. Julietta Swenson, who's a behavioral psychologist at Maui Health. And then Jessica Morricone, a manager of organizational effectiveness, which sounds really cool. I would say that sounds like a cool job at Alexander and Baldwin. And Shireen Vicaris, a human resource generalist at Bowers and Kubota. So thank you all three for being here. And as a reminder, please feel free to type all the questions in the chat box, and we'll set time at the end to sort of address the questions. In the event that we don't get to your question, the American Heart Association staff will follow up with you with a response. And so, Dr. Swenson, thank you for joining. I'm going to start with you today, if that's okay. Thanks for all the work you're doing in Maui. I'll tell you, part of my background, I was a resident in a natural disaster, Hurricane Katrina, and post Katrina, there was a study from Louisiana that came out that showed that heart attacks actually increased in the post-disaster time. And actually at that time, I changed from being a psychiatry resident to a cardiologist for some reason. But what I noticed, and probably what you noticed and you can speak about, is that the biggest concern at that time was mental health. And as we go through climate change, and as we have more, floods and natural earthquakes and hurricanes, the biggest issue probably we're going to face for this generation coming up, public health wise, is displacement. And with displacement comes mental health concerns. So anyway, I'll let you, if you don't mind, just giving us some insights on your experience and what you've seen.
Sure, Dr. Khan, thank you so much. And you know that what you were just talking about, climate change and natural disaster, there's a really great article in I think in JAMA from some of our Native Hawaiian researchers at UH and discussing that very thing. I can forward that to you after the talk if you know.
Sure, that'd be great.
Yeah, taking an Indigenous perspective on what's happened, you know, in terms of the fires. I want to say thank you for having me here. I feel it's just an honor and a privilege. And I read through a little bit of what you wrote, you know, for the slides before we started. And I just wanted to thank you for grounding us in the importance of mental health in the workplace. I know today's audience is a very diverse audience, so I hope with I hope that what I share with you today from the field of healthcare can be translated to your specific professions. As I have been asked to address the health needs post wildfires, I also wanted to thank everyone in the audience who has done their part in helping our community. Hawaii is such a special place, and I know everyone has contributed in so many different ways, and we feel it here. So thank you. I also wanted to thank Queens Healthcare. You folks have been an incredible ally for us, sending out, you know, an interdisciplinary team every day to help survivors of the wildfires. So Queens has done some really heavy lifting in our community. So thank you guys. People may or may not know that healthcare workers are at an even more increased risk of burnout and mental health struggles and suicide than the average population. So I think I had read in your slides that there was the word crisis, and I just wanted to acknowledge that this crisis was happening even before COVID, and that every year about 400 physicians commit suicide in the United States, and just as many nurses, possibly more, do so also, and that these statistics are so tragic. And so we in healthcare have put a significant amount of study and resources in understanding how to prevent burnout and promote resilience and retention. And I think there's the concept that there's, you know, a healthier workforce is a happier workforce. And in medicine, actually a healthier workforce has a direct and positive impact on patient outcomes, which is an idea that I found really fascinating, that, you know, physicians who experience professional fulfillment and meaning in their work make fewer medical errors. And so later in the discussion, I'll just share with you briefly the wellness model that we use in the Permanente medical groups. Just a few words on the wildfires. At one huddle early on, like week 2 at Lahaina Gateway, there was a longtime FEMA medical provider who stated he had never seen such an immediate and thorough medical response to a natural disaster. So we as an island community understand the importance of being helpful in spirit and serving others. And I just think we should take a moment to acknowledge all the various ways people have helped to respond. I spent 2 months working directly with systems of care and survivors of the fires. The experience was exceptionally humbling. You know, when you talked about Katrina, Dr. Khan, it's like working in a natural disaster is like, you have to be on your toes. It's like perpetual change, requires collaboration, communication, flexibility, finding, you know, getting people through pathways of care. And I think since the wildfires, the people in the mental health space have really improved and created a solid pathway for people to get mental health care. And in one of my slides, there's an online form that people can just fill out and get to a provider like pretty quickly. And also I gave Kelly some resources for the employer groups if they want to share with their employees different resources that are available. People in the mental health space, I don't know, that Tia Harstock, who is she's the head of the governor's office on wellness and resilience, and she was a professor at UH in social work, and she's an amazing human being, and she created a virtual space for all the mental health people to come together. And our conversations were really about how to best deliver trauma-informed care, culturally sensitive outreach, improving access to get immediate services, really reducing isolation in the hotels, doing outreach to neighborhoods, and trying to really, continue to create community in the face of devastation. So, and there were just so many great partners: Department of Health, Kaiser, Huino Kealapono, Malama Ikeola, all these, just such great people. There were groups on Oahu that came over and trained our disaster response staff the federal folks that came in to do the recovery. And we had people suit up in hazmat suits, emotional support people while people went through the remains of their property. And, one of the things that I was really touched by in the wildfires is Kaiser lost their medical clinic, Maui Medical lost their medical clinic. And so we had to stand up, medical services, mental health services from, really from the ashes. And, people that were working in the hotel, we had, clinics in the hotels and mobile clinics, and people that were working there had lost their homes, some of them had lost relatives. And yet, reflecting back on those early weeks, I'm still astounded by what our healthcare community was able to accomplish, working in collaboration to pull down barriers to care. And even those, who lost everything in the fire still showed up to help others, and their ability to give was such a healing force at such a dark time. And, and with that said, I just, it's important for all of us to remember the impact of trauma, whether it's the wildfires or our own personal traumas, in our lives. So, it's easy to underestimate it. It's easy to be stoic. It's easy to ignore. And so I think in the work, for employers, I think it's important to touch base with your staff, and help people, if you see health, for all of us to look at our healthy behaviors, our unhealthy behaviors, and staying connected to family and activities that we love and make us feel normal is really important. Housing security is really central to people on Maui right now. For example, children are really stressed because their parents are very stressed. And so some families are separated and living in different homes. Some families are living in overcrowded situations. Some families have moved five or six times since the fire. And it's really difficult to recover and manage family life in these ever-changing conditions. And then right now we are at the 6-month mark post-disaster, which we know from research, the research that there's usually an uptick in suicide attempts. And so I guess if you worry about any of your coworkers or anybody in your family, please check in with them. It's okay to talk about suicide. It's not going to cause them to have new or worse emotions. And so just to be mindful that this is kind of a sensitive time post-natural disaster. So I think that's mostly what I have to say on the fires. Next slide. I guess for employer, go ahead.
Oh, go ahead. Is that back to me or is that still you?
Yeah, I think back to you, maybe.
Oh God, I was just gonna say, I think I'm gonna give it back to you in a second. I was gonna say, first of all, thank you for the work that you're doing. It really is. It can be draining. A couple things come to my head when you were talking. One is there's a saying that character builds adversity. I think through my experiences, I found that the reality is that adversity builds character, but it's really adversity reveals character. So who you are is going to be revealed to some degree. And so what that means is if you have whatever habits you have, whether they're good habits or bad habits, under crisis, those habits get exacerbated. And so it's really important that things are okay that you build good habits. That's one thing. The other is this, I think the World Health Organization has a definition of disaster that I personally really like. It's disaster equals like vulnerability plus a natural hazard. And so a natural hazard would be like an earthquake or a flood. And a vulnerable community would be whatever vulnerabilities you have in your community in terms of how tight your community is, whatever you know, is your, for us, for example, you know, we had our I remember our cafeteria was in the basement and the basement flooded. And so like things like that, or your power's in the basement and the basement flooded. And so vulnerabilities in infrastructure and design and money and resources. And to your point, you were talking about Native Hawaiian health. We know from research and experience that when these adversities hit, they disproportionately hit underprivileged communities. And so that's what happens. And so so I think to your point, the work you're doing is super important to build resilient communities. And I think I feel much more, nothing against New Orleans, but I feel much more confident in the ability and the resilience of this community here in this state. And that's one of the reasons I'm here. And so, because once you have a natural disaster and you're a victim of a natural disaster, I hate the word victim, but you've been through it, you look for things like that. You look for the kind of community you're going to be in. You're always looking for the lowest level of confidence of that community. And I feel like our community has a high enough confidence that we can turn hazards, not and mitigate the disaster part of it. So thank you for that. And then I'll let you go back to this slide and say,
Okay. Well, and I
Go
have
ahead.
a feeling Jessica's going to talk about some of this
Okay.
talk. So I'll just real. I mean, I think, you know, maybe the highlight here is, you know, I think leadership behaviors is really important. Are really important. You know, and doesn't mean that leaders have to fix everything, but helping people get to the resources, checking in, rounding, you know, making sure not just that people are doing their tasks and jobs, but that they're really okay. I think that's, you know, connecting with others is really important. And then, you know, always in my work, you know, if anything we can do to reduce stigma for mental health, you know, working on the inpatient unit, you know, I think people come in and it's a lot of overwhelm or, you know, not taking care of their mental health. But I feel that if people just ask for help a little bit sooner, a month or two sooner, they wouldn't have to have an inpatient hospitalization. And it's that stigma, it's that shame that, you know, if leadership behavior can just really take down some of those walls to talk
Yeah.
about it in a safe space, and that, you know, I just think it promotes a healthier. Oh, I was going to say, during the fires, we had our EAP program we had counselors come in person to talk with our employees. And I think even in healthcare or, you know, if for people that are like in finance or business or, you know, like, I mean, we have a lot of high achieving professionals in our community that are really, you know, we experience stigma ourselves. So I used to be kind of paranoid about EAP services and would my employer they must have a checklist somewhere in the back room, right? Of who's called. And it isn't like that. And I've really learned to be a lot more trusting around, you know, I've heard so many stories of people getting really good help from their EAP programs. So and I met people in the wildfires, they didn't have that. They didn't have that resource. So, you know, if you don't have an EAP program already, I would encourage people to maybe research that and get that for your employees. And then let's see, I think I'm almost, Pal.
Okay.
I wanted to share my
Yeah.
next slide. This is what we use in our Permanente medical group. We use the Stanford Well MD model. There's other models of health and wellness, joy and work. I think Mayo Clinic has like camaraderie groups. You know, that actually one of the things that's important in this work is to if we can, use evidence-based strategies or things that have been shown to work. And of course, there's not research in every discipline or profession, you know, so we don't really have that. But I like this model a lot because it shows what we can do for our personal resilience, right? some of the things you were talking about earlier about self-care. But then there's also the organizational culture of wellness, where employees have voice and professional growth and, there's a relationship of trust and respect. But there's also this idea of efficiency of practice where we can do our job and, there's a bottom line issue, I think, in all businesses. So, but at the center is the professional fulfillment of the of the employee. And I think remembering why we do the work we do, whatever sector we're in, is so important. That the meaning and so, our calling, so to speak, is really important to remember. And so um
Dr. Swentz, if you don't mind sending that out, because that's super helpful. I mean, I would love to look at that and get into that too, just for
sure,
all. Yeah.
sure. And then just kind of a plug, on it says culture of wellness, compassion for ourselves and colleagues. Um, I think that that's something that in this work I've really come to appreciate, that actually, um, you know, so many people have strong work ethics, they're stoic, they're hard on themselves, they hold themselves to a higher standard, and it's important to help give them perspective and acknowledgement that their work is demanding and rigorous, but that it's okay to have moments of vulnerability, like you were saying, and then also, um, that there's a lot of research that actually, because I think compassion sometimes people think sounds weak, but actually, it's highly correlated with higher accountability and is a protective factor for us. So um, that's kind of my spiel on self-compassion. And then I just have some resources at the last two slides, which I think can just give, if your employees are struggling, you can encourage them to use their medical home. And there's groups, there's online resources, I put the lines for behavioral health for HMSA and Kaiser. Um, and then the last slide really is about, really letting people know that there's help available. So, and that there's much better access now, especially for survivors of the wildfires. So, I don't know. I think that's
Yeah.
all I.
Thank you, Dr.
Yeah.
Schultz. I think what I took, so one thing I took also is that you have to be proactive and build a system to help your employees, because they sometimes, when people are depressed, they like that feeling makes you isolated, and then the barriers go up. So that's a great, this was very helpful. I hope we all take this seriously and try to build a structure or a better structure to reach people who are not feeling so well. And it's all of us at some point. So thank you, Dr. Swenson. I appreciate all
Thank you,
that.
guys. I look
Yeah.
forward to hearing the next speakers.
Yeah, and so on that note, I'll so employers have a unique opportunity to improve the mental health of 157 million working adults. I thought this was interesting. So people spend more time working than 157 million people spend more time working than any other activity apart from sleeping. So don't feel that you don't work enough, because it's probably not true. I'm gonna go forward. I'm gonna go to Jessica Marcone, with Alexander and Baldwin. Jessica, can you hear me?
Yes, I can. Hi.
Hi, yeah, so we talked a little bit about the disaster side, so I'm interested to see how you just sort of ingrain that sort of culture on the day-to-day level into your organization about well-being. So want to tell us a little bit about that?
Yeah, thanks so much, Dr. Khan. And hi, everyone. Thanks for having me. And I also just wanted to say thanks to Dr. Swenson for your emphasis on compassion and empathetic leadership, which is, also so important, and for your impactful work with the fires. So amazing. So thank you for sharing. Dr. Khan, when you were introducing today's session, I noticed you mentioned how broad of a reach and impactful mental wellness has, and how it includes really different aspects of well-being. And I think that's such an important point. So when you ask about what our approach is at A&B, we really do believe in a holistic approach to mental health, targeting kind of the various pillars of wellness. So, emotional, physical, financial, spiritual, social, because, at the end of the day, they really all do contribute collectively to an individual's mental well-being, right? If you're having financial trouble, your mental health is going to suffer, right? If you're dealing with chronic physical pain, your mental health is going to suffer. So, we try to make sure to address and focus on the various pillars throughout the year with our wellness program by really trying to feature a different wellness theme each month, including we do have a month that's dedicated to mental health specifically, which is usually May, since that's Mental Health Awareness Month. And then creating awareness on whatever topic we're focusing on that month with, different activities and webinars and challenges to make it fun. Also, every employee population is different. And so it's going to have different needs. And so we like to use data as a starting point to kind of best support our employees' mental health. Last year in March, we did a mental health survey, and it was really the first one we've ever rolled out. We were actually really pleased. We got about a 50% response rate, which doesn't sound super high, but from what we understand from the industry, is pretty good given the sensitivity of the topic and that it was kind of the first time we've done it. And so, excuse me, the results of the survey told us that employees weren't fully aware of the various mental health resources available to them through our existing benefit providers. I know Dr. Swenson talked about how impactful and important an EAP provider is, for example. So as a result, we partnered with our health plan carriers, both HMSA and Kaiser, as well as our Employee Assistance Program, our EAP provider, and Mental Health America of Hawaii, or MHAH, who is another fantastic community resource, to do a mental health awareness campaign, which we did in May, where we brought in a different partner each week to talk about mental health and the specific resources and support available to our employees from them. And so something like that, I think could easily be folded into an employer's open enrollment process by just asking your carriers to specifically address mental health resources in their presentations. And then, I just wanted to quickly share one of the cool tools that MHAH offers that I found out about through their session with us was a mental health screening or assessment tool that you can access on their website, which then kind of kicks out info and resources to help you understand and improve your mental health specific to your results. So it's not meant to be a diagnosis or anything like that, but it's a really nice informational tool and a starting point for someone who maybe is not feeling like themselves, but they're not really sure if they're ready to take that next step of actually making an appointment with a provider, or maybe isn't at the point where they need imminent support, but they're curious, right, about their mental health or their mental health status at that point. So I just wanted to share that. I thought that was really interesting. And then finally, I think in any approach to addressing mental health, targeting individual needs are really key. So we don't have a full program rolled out quite yet, but we are planning in 2024 to offer kind of a new individual wellness arm to our existing wellness program, where folks could opt in to participate if they kind of wanted to take that next step. And it would involve them taking an initial health assessment and then connecting with a wellness coach, likely through their health plan, because both HMSA and Kaiser offer free health coaching to their members, and then creating a personalized well-being plan. And then the company we're looking at if we could support our employees by putting dollars in a lifestyle spending account for that participant to help support whatever personalized wellness goals they set, whether it be, obtaining a license for a mental health app like Calm, or taking a cooking class, or whatever that looks like for that individual. So in sum, I know that was a long answer, but in sum, I guess our approach would be holistic, using data to drive action, and trying to provide support for individual needs as well.
That's awesome. I like your framework of using, people have different models, different paradigms, or advanced organizers. Either it's 8 dimensions or 7 dimensions, the financial, the spiritual, the environmental, occupational. But I think I think that approach is really good to be structured, and actually structured approaches reduce biases, whatever internal biases we have, because oftentimes marginalized employees or marginalized people of different, underrepresented groups are less likely to be marginalized and take a systemic structural approach to your wellness programs or any program really. So good for you guys. I saw something on the slide I want to ask you about. And so there's certain specific mental wellness efforts. There's a handful of them. One of them is this disconnect days. That just sounds like a nice dream for me. I don't think I've ever been disconnected since, I don't know, for 20 years. So I would love to hear about that and the other opportunities.
Yeah, absolutely. So one of the things we've been doing for at least a couple of years now that our employees really love is something that we call Disconnect Day, which is essentially, it's just a designated Friday each month. Usually we have it toward the end of the month, where internal emails and meetings are discouraged. And so we try to announce them ahead of time quarterly. So it lets people kind of plan in advance if they want to either take it as a vacation day, so they know they can do that without, fear of coming back to that mountain of emails that's so intimidating. Or they can use the day for a quiet kind of heads down catch up day to catch up on things at work. So, each year on our employee engagement survey, employees always express appreciation for our disconnect days. And where we used to get comments, that employees have plenty of vacation time banked, but they can't find the time to use it, which I think is a common problem for folks to disconnect. Since implementing this, we have seen employees utilize vacation more on these days. I should also mention too, when we send out reminders for our disconnect days, so we do that usually a couple of days ahead of time, just to remind folks about it. We also include what we call kind of a mindful moment prompt, which is essentially just an informal call to action, asking employees to take a moment on their disconnect day to reflect on or to do something related to mindfulness, usually related to gratitude or positivity or wellness. So for example, this month's prompt, since it's January and the start of a new year, was really around reflecting on a positive change they'd like to make in 2024. So that's kind of disconnect days.
Yeah, that sounds awesome. I'm super jealous. Maybe we can start that here. I don't know. I don't know how I would do. I feel a lot of anxiety. And so a couple of things on that. One is like, the little hacks. One is I found the view arrange desktop icon on my, I don't know if you know this, but you can make all your desktop icons disappear. And I started going around my office and doing a magic trick. I'm like, close your eyes. And then I disappeared and these icons, and the reactions were very interesting. One guy was like, I feel free. The other one's like, what did you do to all my folders? And he started having a panic attack. And so, and the other one is the delay delivery on email. As you're talking about Friday, is like delay delivering Friday till Monday, and just like, because the quicker you send an email, the quicker you get a response, right? And so passing the weekend has been like very helpful for me, but thank you for that. I appreciate your input. I'm going to use that fortitude you gave me to talk to all on those people and say we need to disconnect Friday. So thank you.
Absolutely.
I'm going to ask Sherry from Bowers and Kubota about her employer and community, and just what you're doing there in terms of helping your mental health of your employees.
Yeah, so here at Bowers and Kubota, I mean, yes, we are very involved in the community. We participate, well, each year, we choose an organization to support. So, we have supported AHA, in their Heart Walk. I know this year we're going to do the Kidney Foundation Walk. We participate in, like during the holidays. We'll put together, I guess, bags for, people who are in need, feed the homeless and so forth. So this is something that we do, and we encourage all of our employees to participate. And it gives, when they participate, it gives them a sense of, I guess, a sense of accomplishment, a sense of purpose, and it helps everybody, be more engaged with one another and with the company. And we believe that when our employees participate in community service events, they can give of their time, talent, and treasure, and by being able to help those who really need help, they have different ways that they can lend a hand, which in turn, will help with their own mental health. Just to realize, how fortunate, we are. Well, how fortunate we are, to have jobs, to have a home to go to, and realize that not everyone is as fortunate as we are. So to really count our blessings, and that everyone in our company is so I guess driven to give back to the community. We always look forward to the next community event that that we can all participate in as a team. Our president, Brian Bowers, always encourages and reminds us, how fortunate we are. And, we carry that with us, every day, in everything that we do, all the people that we talk to, throughout the day. And just to encourage one another to continue giving back to the community.
Yeah, sure. That was great. I think three themes I picked up from you is like, number one is like, there's a lot of gratitude in your talk, like how thankful you are for things and how and spreading that sort of thankfulness and gratitude, which is obviously, if the person who feels the gratitude, it obviously helps your mental health probably significantly. The second thing you noticed was meaning. And so meaning is super important, right? And to feel like it's important, to feel like you're making a difference. And the third thing was giving to the community. And the community relationship. So as we get older, like what is like one of the biggest indicators of how healthy you are? Your friendships, your relationships, and and giving. When you give to people, you get more out of it, right? And so I think you really nailed some of the major concepts that are more important than money. I think that's what people have to realize is like your income is like less important than your social network and social relationships, but meaningful relationships. So
absolutely, just being able to give back, without expecting anything in return, and just the feeling that you get, at the end of each event that we participate in. I mean, it's just it makes you feel just so good. So good. It's very uplifting.
yeah, I agree with you. Thank you for that. I always get more out of these panels from listening to you guys, and it just makes my day better. So I appreciate that.
You're welcome.
Yeah. And then I'm gonna go. I've lost my place on the slides. So I got so into listening to you. And so I'm gonna thank you, Serena. I appreciate that. And then
You're welcome.
from the Surgeon General, there's a framework of 5 essentials to organizations that want to support the mental health and well-being of workers, and includes evidence-based practices for doing so. And these findings complement the American Heart Association's Well-Being Works Better initiative. And the 5 essential elements are: 1, protecting from harm. And particularly in the healthcare sector, we've seen a lot more sort of, for lack of a better term, violence in the hospital. And so protection from harm and feeling safe is really important. Connection and community, we talked about that. Work-life harmony, that's really important. And then meaning, mattering at work. And then this one's really important, we haven't really touched on, but opportunities for growth. And so that one is something that, I think we probably all struggle with to some degree, especially the entry-level jobs, and we have somebody very talented. How do you give them opportunities for growth? So I think that's important. I think my script asked Shireen, Shireen, do you have any comments on that? I think I have to go back to you on that.
I'm sorry, on
any of I think you talked about it. I think you covered it. I think we're good, huh? You hit most of that, except for the opportunities of growth. I don't know, that's something we all struggle with, but I think the other 4, you pretty much covered. So I don't know if you have anything else to add.
yeah, no, I don't have anything else to add. Thank you.
Okay, thanks. Thanks.
I just wanted to jump in about the giving back to community at Kaiser. Every year we have our annual day of service for and it builds so much connection and giving back. And in our wellness committee, they've actually presented papers on it at conferences. And so I think that community, I love Sherry that you were saying, like, Shireen, that you were, like, it's really part of the whole. I mean, it's not just one day of service, it's lots of opportunities for people to help the community. And so at the hospital, one of our doctors and nurses started a Malama Aina program where we could go out and work, in various, low-E fields, or, I don't know, plant trees up on the mountains, they're different things. So I think that is a real important piece to wellness. And I guess I wanted Dr. Khan to talk about, the opportunity for growth. I think in healthcare, career development, like there needs to be, like sometimes the career paths can get stagnant. And so I think that that's really, career pathways are really important to acknowledge, you know, along the way.
Yeah, and
And
Dr. Swenson, where the biggest issue we have is our medical assistants and entry-level jobs. That's what I was thinking about. Is like when you're really talented and you're young, you're 20, you're a medical assistant, and you like have a lot of talent. How can the organization support you in a career? And so that you stick
exactly.
with it. And yeah, that's the biggest struggle because we have healthcare shortages. So we see really talented young people?
Yeah.
Yeah. The other thing about Kaiser, I really envy Kaiser is that I feel my friends who are physicians and stuff who work at Kaiser, they really strive for that work-life balance and they have like their field day. I was like, what is that?
Yes,
Like,
we have a
field day,
professional
they're all hanging
development
out.
day that is
Yeah.
amazing. And we put together, I mean, everybody comes together and one year, like I made like, we did like cardio tennis. You can make cards, jewelry making. I made like, a kukui nut lamp, you know, kohaku lamp.
Yeah.
People go surfing, golfing. I mean, it's really fun, and they give
Yeah.
us lunch, and it must cost a bundle, but
Yeah.
I mean, it forges connections with people that you would never know.
Yeah. Yeah. And so kudos to Kaiser for doing that. I'm really jealous. I don't
Yeah.
know. I have to process that. It's so different culturally, but it's
Maybe we need to invite you to come
yeah,
observe.
I don't know. Yeah, maybe it's so very different, but it sounds like a great opportunity. So thank you, Dr. Swenson, for sharing about it. And then I want to thank all the panelists. That was really, again, fun for me. And I hope everybody enjoyed and learned something from it. And I'm going to give it to Glyza, who's the Executive Director of the Hawaii Division of the American Heart Association. I think she's been watching the chat box. And I want to thank her and her team and Kelly and everybody for organizing this event. And so it's, again, a lot of fun for me. So Glyza, I'll give it to you.
Awesome. Thanks, Dr. Khan. This is awesome. Just hearing from Dr. Swenson, hearing from Jessica from AMB's perspective, and even just from Shireen sharing about your work at Bowers and Kubota with the employee base. And so thank you all. Obviously, thank you, Dr. Zia Khan, for hosting such an amazing conversation with our panelists. And thank you to everyone here that's joined the webinar. I know this, as Dr. Khan alluded to, this is an incredibly important topic around mental health. And so we want to definitely keep this conversation going. I know we have a few minutes for Q&A, so continue if you haven't already. Feel free to ping us on the chat or do a one-off ping so we can get to your questions. And we'd also like to thank First Insurance Company of Hawaii for really making this opportunities possible and creating a space to host a webinar to address this important topic. But again, we have a few questions that we've gotten already, and so maybe I'll share this one. First question, how do you promote equality and wellness programs when your company is statewide on various islands or work remote and, you know, in-person staff too? And so I don't know if Jessica or Shireen wanted to help answer this question first, or if you guys have any insight from Bowers and Kubota or AMB.
I can just share, I think a lot of what we do now, because we still do work in a hybrid work environment at A&B, we do have employees off, you know, not based on Oahu where our headquarters is. And so we try to be inclusive as possible. And I think, you know, coming out of the pandemic, that's become even easier because everyone is so much more accessible and used to using, you know, technology to communicate and stay in touch. So a lot of the things we do are webinar based. Our wellness platform is web-based, so all of the challenges on there are accessible to everyone. And even when we do little fun things, you know, just in general, we did like a sun safety webinar. So everyone can watch that. And then afterwards, we're like, okay, let's send everybody some sunscreen, and we'll make the extra effort to mail that to folks that can't come pick it up in the building. So we absolutely try to be inclusive, you know, whatever we do, and thinking through the ways we, you know, the means that we use to communicate and using all the tools and technology we have available to us.
That's awesome, Jessica. I love that. And I know you mentioned earlier too, you guys are looking to launch a more individual wellness arm, right? And I think you're speaking to really meeting employees where they are, especially when they are remote. Like the fact that you'd be able to send over, that bottle of sunscreen and making that an initiative, showing that you are investing in your employees and you want them to have access to all of these resources and tools and be a part of, this program. That's amazing. That's awesome.
Thank
Um, yeah. Doreen, was there anything from Bowers and Kubota that you would want to share as it pertains to promoting equality to wellness programs and making sure we touch all folks who are either remote or on other islands?
For us as well, I mean, we do, we have offices on all the outer islands, and we try as much as possible, to include them, in any wellness activities that we hold here on Oahu. A lot of our challenges through our wellness program, is web-based. So, anyone can participate. For community events, though, that's where it gets tricky. It's like a lot of events that are held here. I mean, obviously they're not gonna be held on the outer islands. But like for some wellness events, like if we plan hikes here on Oahu, we'll let all the outer islands know, that we're doing a wellness event this quarter. We're planning a hike. And we just encourage them, to find a hiking spot on their, on their island, that they can do on the same weekend, that we're doing our hike. For community service, Bowers and Kubota, we do quarterly Adopt a Highway events that we do on all the islands. We're fortunate to be able to have, our teams on the outer islands participate in the Adopt a Highway as well. So we try as much as possible. There are times where it gets a little tricky, but for the most part, I feel like any wellness initiatives that we put forth, that we try to make it as inclusive as we possibly can.
That's amazing. I love that, Shereen. And thank you. Even just acknowledging the fact that we're still trying to navigate this space post-pandemic, right? As folks are hybrid or we have employees on the neighbor islands, what is that communication practice going to look like? And I love how at Bowers and Kubota, if you do host a wellness day or hiking day, you broadcast that message to all your employee base to encourage folks to take this time wherever you are to really go on a hike, get physical, and just making it really a group effort from the organization. So I think that's a great step to really navigate and bringing the employee base together and encourage wellness. I know many of our folks that are on the line are looking to make sure all of their employee bases are engaged. And so I do like that opportunity to actually communicate one day to ensure that we're all being active together. I think that's a great step as well. And even just, I love what you shared about your community day. I mean, encouraging your employees to really participate in a community event, to not just prompt togetherness, right? To make sure we're all building team morale, but giving the employees an opportunity to reflect on the positivity that's going on in their life. So that's awesome. And I even just wanted to circle back to, I think you all have pointed back to that sometimes not all of our employees know the resources that their companies may have as it pertains to mental health, right? Or mental well-being. And I think, I know Dr. Swenson has shared some great resources, but for folks on the call, making sure that we reiterate to your employee base, right? If there's an opportunity to distribute or email what the resources are, if that's a regular newsletter or social media post, an internal newsletter, right? Sharing these communication pieces, I think that's a great start to really making sure that your employees know that their companies are invested in them and have the resources as it pertains to mental well-being. And another question, this is an interesting one. Can you tell us about a time you've noticed that something wasn't working for your team and you had to pivot in a way that had a positive impact on the workplace health structure of your company? And this could go to anybody on the panel. And Dr. Zia Khan, I see you smiling, so I don't know if you have.
Oh, that happens to me like every day. It's an iterative process, right?
Yeah. I know it's a matter of pivoting, right?
Yeah, I'll let somebody else take it. I'll keep my secret secret.
You know, something that we had at the hospital during COVID, right? We have a little gym, and it got closed during COVID, and employees really missed it because they could, you know, work out during their breaks, or, you know, before they go, you know, give service, you know, work with patients. And so we actually, it felt like leadership wasn't hearing how much people were missing the gym. And so, um, as we were talking about that, we also started a wellness and engagement team that was interdisciplinary at the hospital. So while I work for Kaiser and there's all this big wellness stuff, you know, with the medical group, I also work at Maui Memorial, which we're, you know, we are just really beginning to talk about wellness and all of these things. And so, so we renovated the gym, we cleaned it up, we painted, we had a opening. People, you know, are so happy to be back and be able to use the gym. And then I think that's spread to our Kula hospital, and some of the things we do, we have like contests, health contests. And I think our app is Healthy You. And so we have competitions between different groups and floors, and people kind of get into that. But it was a real sore spot at our hospital not be able to use that gym, and then, you know, kind of became the junk room, right? For a while. So that was a big win for our leadership and management and the staff.
That's awesome. Thanks for sharing, Justice Winston. I mean, just like having companies really learn how to navigate to get their employees moving more, or just motivated in general, is awesome. And being able to take the gym and rejuvenate it, and then creating these competitive spaces to hopefully build team morale. That's awesome. I think we have time for maybe one or two more questions. And I know there is just a few that were added in the chat. And so this next question: when priorities and deadlines are competing, and there is no feasible way for everything to get the attention it needs by the end of the week, how does your team make those decisions on what has to take the back burner? And so I don't know if Jessica, you wanted to take this one, and then maybe pass it over to Shireen and Dr. Swenson.
Sure. I know everybody can't do everything, right? And I know we always want to try to do that. That's always our natural. We can't do everything, right? But it is so hard to prioritize. And I think when we talk about, at least as a leader, trying to determine, you know, how do we prioritize that, whatever makes sense for the business. But I think for me, the bottom line would be, you got to make sure you're communicating, right? And when it comes to managing work, it's always about communication and expectation, right? Because it's going to cause your employee more mental stress if they think they have to do this, but you're really expecting this, right? And all that's creating that stress is really just that miscommunication or that gap. So that's one thing I think as a leader, you know, as leaders out there or managers, we can do to help our employees' mental health, is really just making sure whatever the priorities are, whatever the expectations are, we're being really clear about those, to mitigate that potential gap in understanding. I don't know, Shireen, did you have anything to add about that? It's hard, right? How do you manage everything?
It is. I mean, you know, we do. I mean, you know, we here, you know, we're running through those situations where, you know, there just isn't enough time in the day, you know, to meet all the deadlines. You know, like you said, Jessica, I mean, communication is absolutely key. You know, in situations like those, you know, communicating with those that you know, that have, you know, are waiting for you to, you know, to meet those deadlines, communicating with those people, you know, trying to see, you know, is there any way that, you know, the deadline can be pushed back? You know, and yeah, I mean, that's really all I think you can do is yeah, like you said, Jessica, I mean, you know, communicate, because we can't, you know, there's times we can't do it all. You know, unfortunately we try, but you know, we can't.
That's a great point. Thank you for sharing, Jessica and Shireen. I think, yeah, we always want to make sure that there is an open line of communication, and to make sure if you feel like you can't meet the deadline at this point, maybe we be open to have that conversation with your manager. And as leaders, making sure that we communicate that they can share these things with us. So that's very important. Thank you for sharing.
Liza, can I mention one thing? So I would recommend that everyone just treat themselves like they're also their boss. So like when you exercise, like pretend that's a deliverable, because if you don't, the outcome is death, right? And heart attack. And so I would say so one way to put a hard stop on work is make sure you carve out time for exercise and nutrition and treat it just as important work. So anyway, just want to add that.
Love that. Thank you, Dr. Khan. Definitely important. We just have time for one more question, and I'm going to filter through these. Here's one that's interesting. I know many companies are looking to, bring in their own wellness programs and, want to make sure they're taking the steps. Curious to see if anybody on the panel has insight on bringing wellness programs, if it could easily be incorporated with unions, or if anybody has experience or have heard on bringing wellness programs to companies that host unions.
Don't have experience with that. We don't have a union currently at A&B. I don't know if Shireen, you folks do, or if you have insight on that. I can't see why it wouldn't be a good thing, because I know unions want their people to be happy and healthy too, right? It's a win-win. But as far as logistically, I'm not sure how to answer that question.
No, that's okay. And I think the team here will also be sharing and follow up after this webinar, more resources from that A&B and Bowers Cambodia, and obviously that Maui Health, Dr. Swenson was able to share as well. And just some examples that might trigger some ideas of how to start a wellness program in your space. And obviously each company has their own restrictions, own guidelines as pertains to the union and how they partner together. So hopefully that can trigger some ideas and some insight. But with that, I know we just have a minute left. Thank you everyone for bringing and sharing your questions to us personally in the chat. And if we haven't gotten to your question, please know that we'll be addressing that via email later today or later this week. But again, thank you again to all of our panelists, Jessica, Shireen, Dr. Swenson, for joining us today, and especially to our host, Dr. Zia Khan, for just engaging in such a great conversation. Mahalo for our wonderful sponsor again, FICO, who helped us bring this space together. And just lastly, next month, the American Heart Association is celebrating Heart Month. And to kick off Heart Month this Friday on February 2nd, we'll be celebrating National Wear Red Day, the icon day for the American Heart Association's Go Red for Women. So we invite everybody on the call, all of your companies, to join us as we wear red, and help raise awareness. As we know, cardiovascular disease is the #1 killer amongst women. And so make sure to wear red, encourage your team to wear red, take a photo, a selfie, post it on your social media, send it over to us. Make sure to tag Hawaii Wears Red, Wear Red Day, and we'll repost your stories on our channels. But we really want to make sure we encourage everyone to learn more about cardiovascular health, raise awareness, and build education as it pertains to your own health. And then as we just close out here today, I just wanted to share a final quote from the American Heart Association CEO, Nancy Brown. When we make a commitment to the mind, body, and heart, rooted in science and health equity for all, we are better positioned to create healthy communities, especially during these constantly changing times. So with that, I'd like to leave you all mahalo from our hearts to yours. Thank you again, and we'll see you on the next one.